Hi everyone, I'm Dr. Izadi from Preston Wellness Center. I wanted to explain to you what NightLase is and how we treat sleep apnea and snoring with Fotona laser. So with Fotona laser, we have erbium and Nd:YAG. We combine those two modalities with different handpieces, and we treat and target the soft palate, the tongue, and the floor of the mouth to open the airway, and almost do the same thing that they do with CPAP without needing to put a face mask or carry the CPAP with you. So if the cause of snoring is deviated septum, the only treatment would be surgery to remove the obstruction. If it's because of enlarged turbinates inside the nose, then the surgeon needs to remove it. But if it's because of floppy nostrils, when you breathe in it collapses, we can fix it with Fotona laser. And also with Fotona laser, we can fix the back of the throat and the big tongue that might obstruct the airway when you sleep, and fix the issue. Snoring is not normal. Snoring means that there is some type of obstruction in the airway making the noise. And usually when I look at the throat of people who snore, I can barely see the back of the throat because the soft palate is way down, the tongue is big and almost closing the airway. And then when you sleep, your muscles are more relaxed and it collapses and completely blocks the airway, and that's when you have a sleep apnea. And we can fix that with Fotona laser. Now, like CPAP that you have to continuously use it, with Fotona laser, after we finish the course of the treatment, once a year you need one treatment, and if you have a sleep apnea, every 6 months you need maintenance treatment. But it works. It's very convenient, and I encourage you to come to my office and try it. Let me know if you have any